Hey guys, it's Haley, Cosmetology 120, and today we are going to do application of artificial lenses. So the first thing we're going to do is greet our client, escort them to the work area, determine their current preferences and their current style, talk with them about any special needs or requests that they may have, and then we're going to do a skin analysis. So we are, when we do our skin analysis, we are looking for any skin that is inflamed, irritated, broken, raised, or swollen skin in the area that we're going to be working on today. And we are looking for any sores or open wounds in the area, and we are looking for any infection or infestation such as head lice that may affect our service today. After we've done that and everything's clear there, then we are going to go over the client's consultation form with them, and we are going to discuss any medications or products that they've taken within the last 72 hours. And we're going to consult with them about any known allergies that they may have. We're going to assess if the client is prone to cold sores or fever blisters. We're going to talk about any facial surgeries they've had within the last 3 months and if they remain under a doctor's care for those. We're going to talk about any exfoliating or lightening agents that the client has used in the last 72 hours, including AHAs and BHAs. And we're going to assess any facial injections that the client has had within the last 3 weeks, to include Botox or hyaluronic fillers. If the client is free from all of those, then we will go ahead and move forward with today's service. So first thing we're going to do is wash our hands. So we're going to get warm running water and wet our hands, and then we're going to apply liquid soap. And we're lathering our hands. Alright, now we're going to rinse our hands under warm running water. We are going to dry our hands with a disposable paper towel. We're going to turn off the water with the paper towel and dispose of that paper towel in the trash. And then we are going to apply hand sanitizer, and this one is 70% ethyl alcohol. It does have to be between 62 and 70%. Alright, so hands are clean. We're going to apply gloves, and we're going to gather the items that we need. So we're going to get our gloves, which we already have, but we want to make sure we have a couple pair. So we've got our gloves, we've got our barbicide wipes, we've got our eye rounds. Have our lashes. We have some disposable sticks here for applying the glue, disposable mascara wands, some tweezers. We have our lash grip. We have our eye makeup remover, and again some eye rounds. And then we have our paper for the table, our head wrap, and our drape. So we have everything we need there, our equipment. So we're gonna clean the table. So we have wipe number 1, and this is a barbicide wipe, so it is EPA registered and verified to be effective against or as a fungicidal, varicidal, and bactericidal. So step 1 is cleaning and sanitizing. Then we would dispose of this in the trash. That's going to sit for 2 minutes. And then we're going to use wipe number 2 here. And this one is for disinfection, so cleaning the same area, but also cleaning any electrical equipment that we would use today, which we're not going to be using any today. So dispose of this in the trash. And I'm going to set up our table for our client. So this is our paper, tissue paper that we're putting on our bed. And then we have our head wrap, and we have our drape. We're going to help the client onto the bed. I'm going to go ahead and give her her drape here. This is just to protect her clothes. And we are going to apply this head wrap here. Maybe not. Okay. And then we would remove these gloves, and we're going to wash our hands again. So, wetting our hands under warm running water and lathering with antibacterial soap. Okay. And we're going to rinse our hands with warm running water, dry them with a dry paper towel, and dispose of that paper towel in the trash. Then we are going to re-glove for our service. And get ready to go. So we're going to start with cleaning the client's eyes. Makeup remover. Dispose of that. Then we are going to take our mascara wand, wiping through the client's lashes just to ensure that they are in fact clean. And then we would dispose of that in the trash. Then we're going to begin applying our lashes. So I just have the tiniest little amount of, on the stick there, glue. We're just going to let's try this again. And we're going to apply that really thinly. Length of the lash. And then dispose of that in the trash. And then we're going to, first of all, we would have measured these, but these actually fit our client, so there's no cutting necessary. But then we would applying that just above the lashes. I'm just going to show you what we would have done if this had needed to be cut. So I would have had my scissors here. And I would measure this across the length of the eye. And if it didn't fit, then I would have marked it and I would have trimmed it with my scissors. We're going to trim from the outside because the lashes on the inside are shorter. So we would trim away that amount, and then we would remeasure to make sure it is the correct length. And it is. Okay. So now we're going to apply our glue to this side as well. I don't know if you can see that or not. So we're just applying this little bit of thin amount of glue right to the inside of the lash. Dispose of that. Then we're going to apply this Get you a juice.
I can't get.
Hey, kid, look right there on the door. And then we would remove any excess glue. And just whoop. And then we're just going to brush the lashes gently just to make sure that, number one, that they stuck. But number two, that there's no glue in them. And that they're not stuck to anything they're not supposed to be. Or it's not stuck together with the glue. Dispose of that. This is going to go into my to be cleaned. And then any of our single-use products, like our mascara wands, our sticks, anything like that, go there. And then our linens are all going to go to the to be laundered. So we're going to discuss with our client aftercare and maintenance, and how to remove those safely and effectively. Put that in our to be laundered. And then we are going to get our Barbicide wipes again. We have 2 wipes. So I have wipe number 1. And this one is to cleanse and sanitize our area. And then we have, that's going to sit for 2 minutes. And then we have wipe number 2. And this is the actual disinfection of our table. And we're going to remove our gloves. Dispose of those. And we're going to wash our hands. So, wetting our hands under warm running water. Lathering with antibacterial soap. rinsing under warm running water, drying our hands with a disposable paper towel, turning off the water with the paper towel, disposing of that in the trash, and then we are sanitizing our hands again with the 70% ethyl alcohol.